We have all felt down in our lives. In fact, sadness is an inevitable part of life. Failing an exam, losing a loved one, facing uncertainty. Feeling sad is perfectly normal. In simplest terms, depression is feeling down for prolonged periods of time, feeling a significant lack of energy. According to the ICD, there are three main grades of depression: mild, moderate, and severe. The ICD defines depression as loss of interest and enjoyment, and reduced energy leading to increased fatigability and diminished activity. Depression is different from sadness. Sadness can be temporary, and people can recover quickly from sadness. But depression may persist for long periods, taking months or years to recover. Clinical depression is characterized by a variety of symptoms. Lowered mood and reduced energy are very common among patients. They may become tired very easily, even becoming exhausted after an easy task. Patients will likely experience reduced enjoyment, no matter how fun the activity is. Even on vacation, patients may fail to enjoy themselves. Other symptoms include disturbed sleep, diminished appetite, reduced self-esteem, and the loss of pleasure. A person with depression may be easily irritated or annoyed, experiencing weight loss and loss of libido. For all three grades of depression, diagnosis is usually given if symptoms persist for a period exceeding 2 weeks. According to the Mental Health Foundation, 4 to 10% of people in England will experience depression at some point in their lives. People from disadvantaged backgrounds are much more likely to experience depression. Poverty causes people to feel helpless and needy, which drastically increases their risk of depression. According to the WHO, the prevalence of depression in 2015 was around 4.4%, and the estimated number has increased by 18.4% between the years 2005 and 2015. Prevalence also varies with age, as it peaks in older adulthood. In 2013, an NGO, Time to Change, conducted a report on the mental health survey of ethnic minorities. It was found that Asians were more likely to experience depression than Africans. The highest rates of depression were reported by Indian respondents at 61%. There are two important theories explaining clinical depression, namely the ABC model and the social rank theory. Developed by Albert Ellis, the ABC model is a psychological theory of depression. The ABC model states that our emotions are not directly controlled by significant life events. Rather, our emotions are affected by how our minds perceive these events. The ABC model is divided into three components: activating event, beliefs, and consequences. An activating event is any incident that can stimulate our emotions and beliefs. An activating event may trigger negative thoughts or feelings. Let's say a student fails an important exam. This particular event can potentially trigger different beliefs. Some students may feel motivated to do better in the exam, but other students may perceive themselves as complete failure. This is an irrational interpretation of the event. When we interpret events irrationally, we lose confidence in ourselves and our own abilities. We feel upset and hopeless, believing that we can never improve or thrive again. According to Ellis, the habit of thinking irrationally will eventually result in depression. We now turn to the social rank theory, which is a biological theory of depression. Developed by evolutionary psychologists, the social rank theory suggests that depression prevents the loser in a competition from competing again, reducing the amount of conflict in society. Depression ensures that the loser doesn't try to achieve a higher status in society. To summarize, the ABC model suggests that depression is caused by irrational thinking, whereas the social rank theory suggests that depression is useful for reducing conflict in society. There are various ways to cope with depression. One of the most widely known and used are antidepressants. They work by increasing the number of neurotransmitters in the brain such as norepinephrine, dopamine, and serotonin. They work by preventing serotonin from being reabsorbed into the presynaptic neuron. The heavy increase of the neurotransmitter in the synapse is thought to help the neurons communicate better, helping people feel less depressed. A completely different treatment is CBT, cognitive behavioral therapy. CBT can positively impact patients' behavior and feelings. CBT is a form of short-term treatment, lasting anywhere between 5 and 20 sessions. In CBT sessions, patients are encouraged to identify their personal problems and to dig deeper into their thoughts and feelings. Afterwards, the therapist will analyze the client's responses. CBT helps patients to reevaluate the negative thoughts and emotions, reducing the symptoms of depression. In CBT sessions, therapists usually encourage patients to keep a diary, recording their thoughts and feelings on a daily basis. A strength of CBT is that treatments can be accessed online. Patients are not required to attend in-person appointments, making CBT very convenient and accessible. However, CBT may not be financially attainable for lower-income groups. In 2018, a 50-minute CBT session had an average cost of $130. 5 CBT sessions could cost upwards of $700, making it highly unaffordable for people from underprivileged backgrounds. If your loved one suffers from depression, help them by seeking appropriate treatments and support them with words of encouragement. At the same time, give them the time and space to be alone. Give them the opportunity to heal, to relearn, and to recover according to their own speed. To people with depression, speak up. Don't be ashamed to tell your story. Find someone who is willing to listen, whether it's a psychologist or a cousin. Share your feelings with them. Tell them about your struggles. Remember this: if you do not tell anyone, no one will be able to help you. Always remember to express your feelings, so others can help you on the road to recovery.